Alrighty. Hello, everyone.
Good morning.
Alrighty. So, to anyone who is joining us, I am Juliet Rudder, the Community Outreach and Engagement Coordinator from the Healthcare Coalition of Southern Oregon. I run the perinatal task forces in Douglas and Josephine County. And my guests are here with us today to talk about infant dentistry. Would you two like to introduce yourselves?
Sure. My name is Laura McKeane, and I am the Director of Oral Health Services at All Care CCO. And we are a coordinated care organization that, sorry, my dog is decided to whine. We're a coordinated care organization that manages the physical health, oral health, mental health, behavioral health, and transportation benefit for our Medicaid members. And we serve Jackson, Josephine, Curry, and the tip of Douglas counties.
Cool. Alrighty.
Hi, my name is Kelli Beaumont. I work at Grants House Clinic in pediatrics. I am an expanded practice dental hygienist, and I work with infants, toddlers, and teenagers. And I do see adults coming through here as well. My company, I help people navigate to get in services through All Care into a dental home and help parents with their needs and questions and home care with their children.
That is so cool. Alrighty. So I feel like the question that's just burning in my mind that I got to get out is what is infant dentistry and what makes it any different from normal dentistry?
Well, like here at the clinic, we see children from birth on to age 18. And I mean, we're going to handle them a little bit differently when they're the babies, but you'd be surprised how many concerns will come up and home care needs that parents, when they, especially their first child, not really knowing how to take care of their child's mouth and oral care. I did have a baby that came in at 2 months old that did break through its first tooth at 2 days old. So that is possible. And the second tooth was coming in at 2 months. So sometimes children can be born with teeth. So those are things that they do need to see a dentist right away when those circumstances, but I kind of help them navigate. I get to take a look at their mouth, see if there's any concerns, and I collaborate with the pediatricians here if we need to get them a referral or if I need to send it to All Care or direct them to a private office to have their children's and infants' dental needs met. But the biggest thing is at this time is prevention is huge with so we don't have to go down that path where the children need to have dental work and stuff. So we're trying to get them when they're little, and then it's really important to have them have a dental home by, a lot of times they have their first tooth by age 1, so it's a good time to think about doing getting them established at a dental office. A lot of times they do lap to lap, they take a look in their mouth, but the big thing is getting the kids used to us doing that. It is huge. So as I see these kids over and over the last couple of years, they remember me. They're like, oh, is the dental lady coming in? And we try to make it fun and interactive so they'll be not, as they grow older, they're going to be happy adults that are not fearful of the dental office either. We try to make it fun.
One of the things I used to do when I was managing a dental office was I used to take the kids, just walk them up and down the hallway a little bit so they could get used to the different sights and the different smells, the different noises that were in the dental office, because it can be kind of scary. There's not even adults that want to go to the dentist sometimes. So just kind of getting the kids used to that, I found helped a lot.
Yeah, it's huge for the parents that is nice to help them navigate with that and make them feel comfortable where they're at in their settings.
For sure. So yeah, you mentioned a dental home. What does that mean? I don't think we've heard that term on here.
So it's just kind of saying this is going to be your home base, like it's like establishing like a pediatrician doctor. It's that you have that, you establish yourself as a patient there. If you have needs that arise, sometimes children, they have mouth traumas, they hurt themselves. It's always good to have that, we call it like dental home, to be able to reach out to them at any time to have services, because the worst thing is to not know where to go. If something happened or you needed an emergency with your infant or child, but that way we get established. So it's more about just like establishing care with just like your pediatrician doctor, like here at Grants Pass Clinic, and that's a nice stepping stone for here is I see them here, and that way the nurse practitioners or doctors, we work hand in hand together, and we're able to help take care of their, get them established in an office as well. But I'm part of that too. I can help direct them with that.
Cool. Yeah. So another question. So when we're little, our teeth will eventually fall out. So why do we care about dental health when you're itty bitty? Your teeth are going to fall out anyway.
Yeah, that is a great question. And I tell parents that all the time, because we always think just like, oh, they're baby teeth, they're just going to come out. But those teeth are so important to hold that space for that adult tooth to come in, because if we don't have that space, if we don't keep those teeth healthy and decay free, a lot of times that tooth can navigate in a different location. So it is super important to keep those teeth healthy, or if we do have problems along the way, they need to get their dental care. That's why we, prevention, the fluoride, sometimes I have stuff I can put on there. It's called silverdimine fluoride to stop like little tiny areas of decay before they progress. Sometimes they can put a little like colored filling on top of that. And if not, sometimes we just leave it as it is, but it has stopped that cavity in that spot. And then of course with nutrition, starchy foods, things like that, and sugary foods we try to avoid. We don't want to put our baby to bed with a bottle at night. If you're trying to wean them off, maybe just water at that time, but milk is not good because that can sit on their gums, and even breast milk too. I mean, breast milk is best for sure, but we can still have get bacteria and stuff like that in their mouth. So wet washcloth is good to get your infant used to like wiping their mouth out there. If you're always in their mouth doing things, and then naturally when you start brushing their like I just saw a little one with 2 little brand new teeth, and so now we're like, okay, now we're going to move to the little toothbrush, and we're just going to start getting that infant used to us brushing those couple little teeth, and even a wet washcloth on the other gums, but always a really soft toothbrush at that age for sure. But and then as they progress and get older, they're going to watch us brush, and then they like to mimic us. So we are the parents are the biggest advocates, and sometimes if you just go forcefully go brush, but if they see us doing it, give them a toothbrush, then they all work together, and the kids want to make their parents happy, and trying to brush, and you can make games out of it and make it exciting. I could go on and on. Sorry.
Another thing that we do, Juliet, is we go into some of the pediatrician offices here, and we teach them what we call First Tooth program, and that teaches the pediatricians and the medical assistants how to apply fluoride varnish and do assessments of the teeth. So basically look in their mouth and see if they see anything that needs an immediate attention. And what we found by doing that is I love how Kelly can see these kids. Some of the kids don't get to the dentist as often. So we teach the pediatricians to look in the mouth, and that way they can do a referral as well. But I love the fact that Kelly is there at Grants Pass Clinic, and any of the providers there, the pediatrician can do what we call a warm handoff, and that they can walk the child down to Kelly, get them used to her and having her look in their mouth. But a lot of times kids like I said, they don't go to the dentist. They'll go to the pediatrician 11 times in the first 3 years of life, but they don't go to the dentist. So however we can get people, pediatricians, medical assistants, the homes to look in the kids' mouth, we're that much better off. But I applaud Kelly for being at the clinics. And it's not often that you have a hygienist in a medical clinic. So we're really trying to branch out and just get hygienists and oral health. We always say oral health is such an important part of overall health. And by having Kelly there at a medical clinic, we just emphasize that. We want people to know that their oral health is important, no matter what your age.
Yeah, and what's unique too about my job, I can see everybody. I can see non-insured, I can see private insurance patients, and we don't turn anybody away because I work, with Capital Dental as their expanded practice hygienist in this co-location here at Grants Pass Clinic, and then with the help of All Care and stuff. But it's wonderful that I can see everybody. It is, and even our private patients, they need help too. I mean, dentistry is expensive, and it's nice to lend that hand or help them navigate their services as well. So I feel truly blessed to be able to do this. But we do need more hygienists out in clinic settings with medical and dental integration. That's awesome.
And I know with February being National Children's Dental Health Month, there's a lot of focus out there on getting the kids seen, and maybe events going on in the community and what people are doing in the community. And I know Options is doing some work this month for kids, Children's Dental Health Month as well. Not Options. Did I say Options? I meant Siskiyou.
Siskiyou, yeah.
Siskiyou Community Health Center is doing some special things this month to emphasize kids dental.
Cool. That brings up, so ideally, when would you like a child's first dental appointment to be?
Oh, yes. If you could get them by age 1, would be good to get them, have at least eyes on them. And I feel like that's where I come in. I can check them out if we need to send them, but it is good to get them established by age 1, or their first tooth, or at least within their first tooth within 6 months of that erupting in their mouth.
Okay, cool. All right. And I was also wondering, like, what other partnerships do y'all have with other clinics, or even partnerships within Grants Pass Clinic?
I know Siskiyou does the WIC program. That's another great resource, especially with moms with the being pregnant and stuff. They can get help through them as well. We do have, before the pandemic, we had quite a bit of events we were doing, but right now everything's kind of slowed down. And into Medford, we did quite a few events as well. But a lot of times we collaborate with other, like, besides us with Capital, but with Advantage Dental, and there was a Starting Strong program with Jackson Care Connect out of Medford we were doing up until the pandemic, and I know that will probably restart here when everything calms down and we get vaccinated. So.
And I was also thinking, Kelly, about the baby shower event that happened.
Yeah.
I can't remember if it was Advantage Dental or Capital that was there. I want to say it was Advantage.
Yeah, we did.
Dental.
We've done that one too. That was a lot of fun. We went ahead and did that together in connection with Advantage Dental, and we both had our setups, and we collaborate with that, and we work hand in hand very well with the other hygienists and stuff. So it's a good collaboration. Yeah, I'm looking forward to that one. Maybe next year we'll be able to do that.
Fingers crossed.
Yes.
Right.
And I was gonna say too, you guys do the Healthy Start program and stuff.
Yeah.
Yeah, I have to say, when I first got out of school, I was one of the first parents on that program. I was nervous being a new mom, and I signed up with that because I just graduated a dental hygiene school and I was pregnant. So I was like, oh my gosh. So when I saw that, I was like, yes. So I got to benefit from that. So pretty
That's
cool.
awesome.
Good. That's wonderful. I'm really happy to hear
Yeah.
that.
It's been a while, but I think she's 26 now, but it's been a while.
That's awesome.
Thank you. Yeah, that's great. So are there any events that you'd like to plug to tell us about?
I was thinking, I don't know, Juliet, if you could show the flyer that Siskiyou had sent over. I don't know if you can share your screen while we're doing this and show it. If not, I could just maybe give the details about it.
Why don't you go ahead and give us the details? I will be sharing the flyer to the Healthy Start Facebook page when we're done here.
Okay, let me pull it up here. So Siskiyou Committee Health Center in Grants Pass, they are doing free children's oral hygiene treatments, and that's going to be this whole week of February 8th through the 12th. And you just have to call them for an appointment. So I'm going to give you the phone number here. You can call 541-479-6393. And that will be available in Grants Pass and Cave Junction locations because they have a beautiful dental clinic out in Cave Junction. And plus, during the month of February, when children visit, they will get a free dental hygiene kit when they come and get their visit. So once again, you can call Siskiyou at 479-6393, make an appointment. This is going to be for children 14 and under. They're also doing a coloring contest. And if you win the coloring contest, you win an electric toothbrush. So that is pretty cool. So, or you can go to their website and I think they have information about that as well.
That's fantastic.
And I think too, even with the Grants Pass Clinic too, so if you are a patient here, I can see you for free and do the fluoride, do the assessments on the children and navigate services. And I do dental sealants. I have my own room here that I'm able to provide those services and silver dining fluoride as well. So anybody that is a patient here at the clinic is more than welcome to, you can make an appointment with me or in pediatrics, I do hop room to room, but if you want to, especially, you just call and ask for dental and they can set you up with that.
Awesome. Oh, and I cannot believe that I spaced this. Due to COVID, are there any special safety practices that y'all have adopted?
Oh, yes.
Oh, yes.
Yeah, we've had lots of changes for sure. In fact, just not wearing a mask right now. Like, wait, I'm in my own room.
Yeah.
But yes, high protocol with everything. And in fact, Grants Pass Clinic, you can't obviously have any symptoms of it. You can't even come in the building. So they're really good about doing the precautions, as I would too if I was in a traditional office. And when I'm at Options of Southern Oregon, we do the whole screening as well. But yes, and then just extra gowns and protection and things like that. But we try not to make it scary or anything. But yeah, we do definitely have extra precautions.
Absolutely.
Good, good. Yeah, I try to not forget that kind of thing because I mean it's the new normal now, but you know, everybody wants to know because like you got your mouth open and someone that you
yes.
like
yes, and that's the big thing with the kids. I'm like, now you can take your mask off, and so I get to see their wonderful little smiling faces. So that has been a treat almost. But I remember when I first came back, I'm like, how am I going to be a little more interactive so they know like I'm smiling at them? But I try to smile with my eyes and make gestures and stuff. But yeah, with the kids, because you don't want to scare them, you want to make it the most positive experience. And a lot of times the parents, sometimes they're a little hesitant, like, I don't know, they're going to cry, and then it turns out to be a great experience. And they're like, wow, we couldn't even get them to do that before. So we've got a lot of good wins with it.
Oh, that's fantastic. I'm really, really glad to hear that. Okay,
Oh,
well,
and I want to say another thing too. The kids also get their eyes on them through Head Start, and I know they're starting to open back up, but we do have a hygienist that comes out, and I have helped with that as well. And they get eyes on them like 3 times a year. So there's it's myself, and there's another hygienist that does it full time, and she goes to all the Head Starts in all of Southern Oregon. So that is another benefit of signing up with the Head Start. They do from infants on up to age like 4 or 5. So yeah, that's another good resource.
that's awesome. Yeah, thank you. That's really fantastic. So, Laura or Kelly, is there any last words that you'd like to share with parents or partners or any such thing?
I think if I was going to share anything, I would just share to parents, especially, that, you know, as soon as that first tooth erupts, even if it's just one tooth, it's so important to keep that tooth clean and keep fluoride on that particular tooth. Like Kelly said, she had somebody that came in that had a tooth at 2 months old. Some kids don't get their first tooth until they're 6 or 7 months old, but it's just so important to keep those teeth clean. Even like she said, if you can't brush that tooth, if you're using just a cotton swab or a washcloth, even to wash that tooth off after eating, it's really important. Try not to put kids to bed with milk in their bottle. If you can, try and do water instead of milk or juice. And just remember that your dental health is just it's a part of your overall health in general, and it's just important that you keep those teeth healthy and strong.
Awesome. Kelly?
That was well said, Laura.
Thank you.
I have to agree with her with all that. That was totally correct. And just keep them and getting our eyes on those teeth if parents have questions, but the overall health effects, if we can get these from the time they're infants to adulthood, I think the more of us that are out there taking a look at these kiddos, the better off the next generation is going to be, because dental caries is the number one. It is a bacteria in their mouth, but it is a disease. And if we can prevent that, that's huge. It's the most preventable disease out there, but so many children have it. So if we can partner up, and we're very thankful for All Care partnering up with us to provide these services and collaborate with all these great groups. We're going to keep expanding. So I am super excited about the future with this. Kind of, we're all paving the way for the next generation.
And visit your dentist. Visit your dentist.
Visit your dentist. And your hygienist, of course, right?
That's true.
But it is good to get established with a home, dental home, yeah.
Well, thank you both so much for joining me on here. We've had a couple of people watching, and I'm looking forward to many more people watching as well. So have a fantastic morning and the rest of your day. And I'm going to go ahead and say adieu to all of you lovely viewers as well.
And thanks for having us, Juliet.
Yeah, you're welcome.
Thank you.
Bye.
Bye.
Bye.